gonna get this started. Welcome everyone, and we're gonna be going over empowering tobacco cessation and how motivational interviewing supports everyone's every stage of change. And for today's presentation, we have an amazing, great guest speaker who I'm gonna introduce in a bit. And we have our learning objectives, which are we're going to be trying to understand how stages of change model specifically applies to migrant seasonal ag worker population, apply motivational interviewing techniques while using scenarios to effectively support tobacco cessation at each stage. And we're hoping that you're going to be able to also get some great resources on how to go about and do tobacco cessation interventions, as well as tools that you can use with your patients, as well as any health center staff. So the first thing that we want to share is that NCFH has been working on the tobacco cessation efforts for some time now. Last year, just freshly recently released, we worked on a guide for health centers to address tobacco cessation using use amongst agricultural worker patients. This was a very comprehensive guide and touched on different aspects of tobacco use, from what are tobacco products and its related health risks, as well as different interventions that health centers can use to address that. So we highly recommend that you look at this guide, and we're going to be sharing the link in the chat as well in a bit. But this is what we are building off from. And one of the proven evidence-based interventions that we have seen work the best in health centers is using motivation and interviewing to address the stages of change. So that's what we're going to be going into, and hope that it's a topic that all of you enjoy. For today's presentation, we're really excited to have Michael Pyne as our guest speaker. He has a vast experience in motivational interviewing on suicide prevention and so many other things. He works with the Health West Muskegon Behavior Wellness Connection. And we're really excited to have him here today. So with further ado, I'm going to stop sharing my screen so that he can start sharing his. And Michael, we welcome you and thank you for being here with us today.
No problem. Am I pulling up my slideshow on my end then?
Or I can keep yours and I can just advance.
No, I'll do that on my end here. Hold on. Now I'm slowing us down. Give me 2 seconds here.
Oh, no worries.
For whatever reason, when I open up my PowerPoint, it doesn't let me open up other screens. So it's a little disappointing. Yes, I am Michael Pyne, and I do work in Muskegon, Michigan. I live in beautiful West Michigan. I've been a social worker for 40 years now. And today I am going to talk about motivational interviewing, stages of change, specifically under motivational interviewing. Everybody can see the screen and it's working good?
It is perfect. Thank you.
Okay. And so I'll just sort of start with when I first learned about motivational interviewing, which I didn't learn about in my career until about 17, 18 years ago. But when I first learned about it, I thought, wow, this is wonderful. This is going to be so helpful for me. Everybody I know in social work is going to want to learn all these things. And we're still working to really get social workers even to really to understand the value of motivational interviewing and the various skills that it would take to do motivational interviewing in a way that helps facilitate change. having said that, it's not a big scary thing. I think it's just one of those things that we should constantly be practicing. So today we're going to learn about the trans theoretical. We all get to use these really big words too, right? Not that you have to. Trans theoretical model, right? Developed by Prochaska and Di Clemente. They're going to outline the stages of change that all of us go through when we're working on a change that we want to make in our life, a change for a certain behavior. So, what is that model? Before I get into all of that, the big question is why bother with this? Why bother with the stages of change and motivational interviewing? And these are some really important points here, right? It enhances the client's motivation. Motivational interviewing helps that individual that we're working with to resolve ambivalence and to maybe start to think about change and working towards switching a behavior to a healthier behavior. It also is client centered, right? It's not about us as the worker anymore. It's about the individual taking those steps towards change. So the approach emphasizes that, and at the end of the day, that individual is in charge of the change. And some of you may already be aware that it can be really, really frustrating working with people and you think, why don't they just do this or why don't they just do that? To which I would say, if I came to your home and I visited you for a couple of hours, I could probably tell you many things that you could do in your life that would make your life better, that you may or may not do, right? Or why are we not all rich right now following the advice of financial advisors? If I would have started in my youth, maybe I'd be retired and on a beach somewhere if I would have been implementing some of the things I needed to do. My behaviors around money maybe weren't as good as they should have been. Why do I eat all these cookies at night? Why am I not able to get back to the gym? But this puts it back on the individual because anybody can tell us what we need to do to change. It's super easy to say to somebody, you shouldn't smoke because it'll kill you and it does horrible things to you. We all know that. Then it becomes, now what do we do to take steps? And it puts it back on the client. And there's an autonomy there, and the individual develops that capacity for change. And it really is a sense of empowerment. When we master something, we feel good about it. And I don't care what it is out there. Go learn to play the ukulele, go learn a different language, learn to paint, or any kind of a skill, anything that you learn in your life that you get good at, you always feel good about that when we do it. So it puts it back on the client more than us. And we can't drag somebody into change, right? We can try, but it's going to lead to problems. Also, it could lead to a relationship with that person that's adversarial, and that's of no value. If we're fighting with the person for the change, one, that person's probably not going to change as quickly. And it's also going to give us, lead to more burnout and compassion fatigue in us. It's going to be exhausting. And so this is one of the reasons that I also thought, in my, 20 years ago, I thought, this is amazing. It's no longer about the fight. Excuse me. It really puts it back on that individual. We're going to approach them with empathy. We're going to be as non-judgmental as possible. And we're going to walk that path of change with them. Sometimes it'll be frustrating. Excuse me here. The other thing, too, is motivational interviewing is really effective for people who are unmotivated, don't want to change, or resistant to the change for all kinds of reasons. It really is a helpful way to gently get into change. And then I would ask this question, why are you personally working in this field? Anytime I work in an organization, we have about 500 employees, and occasionally we'll send out surveys to our staff about their well-being, how things are going, morale, etc. And we'll ask people, why did you get into the field? 98, 99% of folks are going to say, I wanted to help people, right? Some of us are here maybe because the education was easier for us and we feel like we're okay at it and it's a job, and maybe it's not just about helping people. But overwhelmingly, we got into this work to help people. That is about compassion, and that is about empathy. We want to help people in the world. When we begin to burn out and struggle with compassion fatigue, that part of the brain that is responsible for empathy and compassion begins to shrink, literally shrinks, right? It atrophies. If we are not struggling with the client anymore and we're using these approaches, we're probably not going to burn out as quick, and we're going to be much more compassionate and hopefully empathetic to folks. And then when you get to be my age and you're looking at retirement, as I mentioned to some folks yesterday, you won't be that person at the holiday table that everybody rolls their eyes at and nobody wants to sit next to, right? Because this type of work of helping other people can lead to that. You become bitter, burned out, you don't care, you dislike the people we're serving. And that's no longer what it's about. It's about helping people change. So back to this trans theoretical model. What is the trans theoretical model? Is stages of change. When we are working to change a behavior, they have identified that there are certain stages of change that we go through. Now, why is it important, right? The model is widely used to help individuals understand and navigate the process of change. So the information we're sharing today isn't about some secret thing that you do with a client magically in the background. You can share the stages of change with them and also use it for yourself, your family, etc. Why is it important, right? Readiness to change is often considered the most important part of helping someone change a habit or a behavior. If they're not ready to change, you will be just frustrated, possibly, or banging your head against the wall. And you don't have to do that when you implement motivational interviewing, and when you also understand what stage of change that person is in, which we're going to get to in a little bit more detail. And some of you are maybe very aware of this already. Some of you maybe not. It's important for us as that intervention or as that worker to understand the stages of change so that we understand the person we are serving. And this builds rapport, as mentioned earlier. It makes the job more meaningful. And that connection is also what helps people change. And then we can work with that person without being frustrated, without having our hair on fire. Oh no, we're just running from crisis to crisis, and this person won't do that. We won't be that person. Hopefully, we'll be more at ease. Now, it sounds like I'm talking more about you than the individuals whose behaviors and habits that we're hoping to change. But the benefit is for both. The benefit is for both. So, 17, 18 years ago, when I first started down this path of motivational interviewing, I thought everybody who worked in social work would jump all over this and we would all practice this all the time so that we wouldn't be bitter and hateful towards the people we serve, right? So let's think about behavior a little bit here. Okay, I'm going to use examples of what I consider to be bad television that I've watched, okay? Has anybody here watched My 600-Pound Life or any of the many hoarder shows? I don't even know what they're called. There's a million hoarder shows out there, right? Or Intervention, right? These shows are on. What happens in the first 10 minutes of those shows? Almost every single one of those shows, in the first 10 minutes, what are we hearing about? We're hearing about the individual's trauma. No one says, I can't wait till I'm an adult and I can weigh 600 pounds. I can't wait till I'm adult and I have a nicotine habit. I can't wait till I'm an adult and I have a heroin problem. Nobody does that. There was a catalyst that put that person on that pathway. And when you watch those hoarder shows, it's what we hear about first. Some traumatic event occurred. They lost a loved one and they struggled to handle that. And then they started making these poor choices for themselves. And then what do you have? Sometimes on these bad TV shows, you'll have a social worker standing on the front lawn with somebody yelling at them because they won't throw something away. That's not motivational interviewing. It's not good social work. It probably is good television, but it doesn't work, right? That frustration is in there in many of these shows. You can have a doctor, sometimes a therapist. I'm sure there's probably good therapists out there on these shows. But for the most part, the rest of those shows are just exploitation of somebody who has suffered a traumatic event and they're suffering. and we're trying to see if they'll change on their own. And they're not very good examples of motivational interviewing and the stages of change, right? Trauma and poor health. The connection between trauma and poor health has been proven time and time again. It's called the greatest medical discovery of our time. When we experience traumas in our life, we sometimes pick up bad habits. It puts us on a path, right? So what are the stages, right? We're trying to help people. And in your situation, maybe we're trying to help people with smoking, weight loss, diabetes, etc. So let's talk about the stages. What are they? Number one is pre-contemplation. We're going to go into detail with these. Number one is pre-contemplation. Number two is going to be contemplation. Number three is preparation. Number four is action. Number five is maintenance. Number six is termination, sometimes called transition. And then I did not call relapse one of the stages of change, because I don't feel it's a stage of change. I feel it's something that can interrupt the stages, the progression through the stages of change, and can knock people back. But I don't consider it. Sometimes you'll see models out there and they have relapse as one of the stages. And a lot of times you can hear people talk about addiction and some other things, and they'll say, well, relapse is a part of recovery. And it is for many, many people. Relapse is a part of recovery, but not for every single person. And that's important to know. So here's a pretty picture of the stages of change, right? Pre-contemplation is sort of outside of that. Contemplation, preparation, action, maintenance, right? And then we've got transitioning out of the services or termination of the services. And the possibility of relapse too, which we have to not be too frustrated about when it pops up. It's hard to do when it's family, right? It's really hard to do when it's family and there's a relapse, or even when it's ourselves. Man, I was losing weight. I was doing so good. Now I can eat a whole chocolate cake at night alone by myself. Why am I doing this? What's going on? Right? We can get knocked back too. So let's talk about the stages of change. So the very first one is pre-contemplation. And this individual is probably at the point where they don't really care about changing it, right? Many, many years ago, almost 50 years ago, 40 some years ago, I worked with a guy and he smoked. And I would say, hey, that's going to kill you or whatever. And he was like, I love smoking. I love my cigarettes. I've never met anybody like him in my life. I love smoking. Wow. Okay. That's an interesting approach, right? So this person was definitely pre-contemplative, wasn't interested in contemplating whether or not he would quit smoking at all. Can be a denial that there's an issue or a problem. It can be a lack of awareness of just how dangerous some of these habits can be. And of course, that builds some resistance. So if somebody is pre-contemplative and we're working with them on their recovery, what are some of the things, some of the questions we can ask? Now, this is just going to be a little bit of a dip into those questions. There are obviously many more. I believe you'll get some other support material from the coordinators of the event today. There's plenty online about motivational interviewing. You can go through, well, in the state of Michigan anyway, and I think if you're outside the state of Michigan, you can go through 21 or 24 trainings online, motivational interviewing for free at a website that the state of Michigan has here. So there's a lot more information out there than what we're going to hit today, but we're going to give you the basics. So when somebody is not interested in changing, they're pre-contemplative, don't think they have to change. Here are some questions we can ask, So what do you think about your current smoking situation? What are your thoughts about it? What would need to happen in your life in order for you to maybe change, right? Is it a cardiologist telling you that you're going to die prematurely? What might they say? What would need to happen for you to consider making a change? And then just have that conversation with them. It's their conversation. Well, I suppose if my children get a little older and they don't like it and whatever, maybe I wouldn't want to do it in front of them. Okay, let's talk about that a little bit. Or how do you feel about the impact of your behavior on your life or your health? What are your thoughts about that? Smoking's a big one. And you say to somebody, hey, smoking is dangerous. And somebody says, well, you got to die somehow anyway. And then I often think, but cancer is a really slow, painful, horrible death. It's like, that's the one you may be choosing. I never say this out loud to anybody. I've never said it out loud, but I think it in my head. And maybe it's okay to occasionally say it out loud to maybe family, friends, and ourselves. So that's pre-contemplation. Now somebody, maybe we have these conversations, we ask certain questions, and maybe they get to the point where they're like, you know what, maybe I should consider changing. And that would be contemplation. Now they're considering change, right? The individuals are aware of a need to change, they're thinking about it, but they're not really committed to it. I told my wife the other day that I was going to go back to the gym with her because I haven't been, starting in January. I'm contemplative. I'm close. I'm not in the gym yet. I don't know why I said January. I could just as easily be going with her today, but I'm in that space, right? Personally, I'm in that space. And I know that's for some of you, you're never in that space, right? Maybe you're really good at exercise and taking care of yourself. I occasionally struggle, right? So I'm contemplative. I'm getting there. And the key characteristics, right? There's some ambivalence, weighing the pros and the cons, increased awareness. Yeah, I know I would feel better if I went to the gym. I always feel better. I could definitely stand to lose a few pounds. When I lose a few pounds, I feel better, etc. So, what are the questions we would ask somebody? How do we have that conversation? We're not going to fight with them, right? Anymore. So then we say to them, so what are the pros and cons? You're contemplating it, you're thinking about it. So what are the good things about smoking that you can list? And what are the bad things about smoking, maybe that you could list? Have you thought about them? And then what concerns you about making a change? Or what is that? What concerns do you have if you made a change in your life? What is that going to lead to? What issues or problems or concerns? And what would motivate you to go, you know what? I think I can do this now. And they may have something for you that you could then grab hold of and go, let's see if we can make that happen. Right. I have a physical, once a year physical coming up at the end of December. And I think, oh man, I got to go in there and I got to be in a little better health than last year. I've got to impress my doctor somehow. I don't know why I think that, but I do. It motivates me, but I'm not going to the gym probably before my physical. I should, but I'm not. So that is the contemplation stage and some questions we can ask. So let's talk about preparation. Now we're starting to get there. Okay. Starting to make a plan. I'm maybe not as contemplative. I'm in the contemplative planning stage. While I'm planning to go to the gym, we're taking some action where we're going to take some action soon, and we may start taking some small steps towards change. And so the individual might start planning, getting some resources, some alternatives to smoking. They may start taking small steps, reducing, their nicotine use throughout the day. But now we see a little bit of preparation taking place. And usually the preparation stage shouldn't last long. So as we talk about questions we ask somebody who's in the preparation stage, we want to be careful that we don't spend too much time in the preparation phase with that individual, because it's a place where you can get stuck for a very long time. So we want to be cautious about too many questions for too long in the preparation stage, right? What have you already done? What sort of things are you doing maybe now? How are you preparing? What are things that you're thinking about as you're preparing here? What support do you need? What are the things I might be able to do for you? Or what things might you need from your doctor or the pharmacy? Or, what other things can we do? And then what are some ways you can set yourself up for success? And maybe then planning takes place there, right? So when we're done with our preparation stage and our planning stage, hopefully we're stepping into action. But before I get there, let's just throw out relapse, right? So that person could have come this far with you, and you as the worker, you're thrilled, things are going good, the person's taking steps, and now all of a sudden they're back to pre-contemplation and they're not interested and they don't want to talk to you about it anymore, right? Now what? They may have frustration. It's possible you could feel frustrated, but we go right back to the beginning and we ask those same sorts of questions. Maybe we find new ways to ask those questions about health and related things, but also explore, what is that thing that maybe knocked you back on that path? Is it fear? Sometimes we think we're not good enough, even for ourselves. And to explore the reasons, what do you think it was that knocked you back on the path, that took you down a few notches and has caused this delay? And ask that person, because relapse can happen at any one of these stages. And so we want to be aware of relapse. So let's talk about action. Now we're actually doing things. I'm at the gym, I'm working out, I'm getting my muscles toned up again. Life is great. I'm taking the steps, I'm doing what I need to do. I've stopped with the cigarettes, whatever it is. Now they're in the action phase, they're doing it. They're implementing their plan. We see changes in them, we see commitment, all of which we should be praising, of course, in that individual. Wow, way to go. Even if it's 1 week, right? 1 week without cigarettes, way to go. Great. I can see it in you. You look better, you feel better, etc. So then what questions do we ask in the action phase? Besides just praising somebody for the progress they're making, what strategies are you using, so that you're going to be able to maintain this? I would urge caution about how we word this, right? We don't want to imply they're going to fail. But we also want them to, what are the things you're laying out so that this will be a continued success throughout your life, and you don't have to worry about smoking related illnesses anymore. Hopefully, right? What challenges are you facing when you quit? Do you have cravings or whatever? How do you overcome those? What are some things you're doing when these things pop up and they want to knock you back on the path? How are you confronting those things? What are you doing? Learn from them and have a genuine a curiosity as you can, right? I want to learn from other people who are successful at changing those behaviors, not just because I want to help that person in their life because of my job, but because I just want to understand how human beings do change and are successful. And I even have to struggle to make changes. So I'm going to learn. We're going to learn together as you're walking this path and I'm with you. We're going to learn together. What are the challenges? What do you do with the cravings? How do you talk to yourself about those things? And then how do you feel about your progress? Well, it's only 1 week, so I'm not there yet. Okay, but 1 week is good. Let's see what happens 6 months from now. How do you feel about your progress? How's your health? Let's keep coming back. So they're in that action phase. And now the next step, the next stage of change is maintenance, providing we haven't relapsed, right? Now we're in the maintenance phase. So the individual is sustaining the behavior change. They're doing positive things over time. They're making certain they have things in place that would help to prevent relapse. And we can recognize that maintenance phase because they have this long-term commitment, and hopefully they're vocalizing that. Nope, I never want to do it again in my life. I don't want this to be happening, right? And what are their strategies long-term? Who are their supports? What are their supports? Who are the people that are supportive for them? And what are they doing to support themselves? What materials do they have? What do they need? That is the maintenance phase. And then what questions would we ask in the maintenance phase? They're doing well, right? Hey, what's helping you stay on the track? What's going on? Similar to the action phase, right? What triggers might lead to relapse, right? How are you managing those? If you've ever smoked and quit for a long period of time, I had a family friend tell me they quit smoking during the Korean War. And this gentleman was in his 60s and he said he craved cigarettes every single day. And at the time I was a smoker and I thought, man, I'm going to have cravings the rest of my life. But that has not been true for me. I quit smoking and I do not have cravings. And as a matter of fact, when I do see people smoking, I often think, well, that's a weird thing to do. Put burning leaves in your mouth and suck it into your. I mean, the whole thing is in my head, it's kind of a bizarre thing. So I'm okay with it. But other people may really struggle, and they could struggle for years and years and years. Same is true for alcohol and drug addiction. Weight loss is a particularly challenging one, and we need to be aware of that. And how are you going to continue to reinforce those habits? termination or transition, right? The individual now maybe is no longer in need of our services. They're doing well. So we're talking about discontinuing the supports we're providing. In my organization, we transition people out of supports. That's what we call it, termination two. So it's hopefully going to be marked by stable and enduring change. And of course, there's not really, you may ask questions during this phase, but it's not necessarily about what stage of change that they are in. Are there any questions at this point?
They're not in the Q&A, and a conversation in the chat hasn't been
Okay.
we haven't had any questions. So
Okay.
if anyone wants to add anything, we can for sure address it at the end, and
Absolutely.
glad to continue conversation around your questions.
I know
Thank
we
you, Michael.
started. I know we started a little bit late, and even though the information is pretty minimal, I figured it would go quite quickly. But I also don't want it to feel too rushed, right? And I do know you will get support materials after this as well, that hopefully will also be helpful for you. We've also had a number of our own employees. I had mentioned yesterday, we did this many years ago. We have rolled this out and rolled this out and rolled this out in our organization. And a lot of this takes practice, an ongoing practice as a community health worker or as a person serving other people. A lot of this does take some practice to do regularly, and to do it in a way that is genuinely helpful for the people we serve. But we provided the introduction to motivational interviewing to all of our staff, and that included the clerical staff, people who worked in IT, people who worked in data analytics. So we didn't just give it to social workers, we gave it to everybody. The people who were most thrilled about this information were people who used it with their children, who did not work as social workers. It's like, oh, this is all brand new to me. I use it with my kids now, and it's wonderful. We don't fight as much. There are other uses, right? There are other uses. So I'm going to throw out a scenario here. We'll let you throw this into the chat, just to see what stage of change do you think Juan is in here. So Juan has been a smoker for over 10 years, and recently he started to notice that it's having a bad effect on his health, shortness of breath, he coughs a lot. His family and friends have also expressed their concerns about his smoking habits. Look, I got a typo in here I found already. He's been smoking for years. He has started to notice negative effects. Juan acknowledges that smoking is harmful and he's thinking about quitting. He often thinks about the benefits if he stopped to his health, and saving money is a big one. However, he also feels ambivalent because smoking, it really helps him out when he feels stress and anxiety. Throw it into the chat. What stage of change you think Juan is in? So he is, we're seeing two pop up. So sort of contemplative, right? He sees the issues. He knows it's harmful. So he's at least considering. It's not like he's like, I love my cigarettes. I'm not going to quit. He sees the issues. He sees the concerns, but he also listed here what he considers to be a pro, right? He listed here one of the benefits that he feels he gets in smoking. So then it begs the question, is there some other thing we can give you during times of stress that would help you out rather than something that's possibly going to lead to a prolonged and painful death? Not that you would say that to Juan at the time, but is there some other thing we can replace it with too, right? So yeah, he's likely in the contemplative stage. And he can go back and forth between contemplation and pre-contemplation for a long, long, long time. People can, and they do. So here's a second one. Throw this one into the chat as well. Juan's been leading a sedentary, sitting around, we're off of smoking topic here, but, sedentary lifestyle for a long time, sits at work, goes home, sits on the couch. Recently he had a health scare that prompted him to take his doctor's advice seriously and start exercising. So Juan has decided to make a significant change. He's going to incorporate regular exercise routine into his habits, and he set his goals and he's working hard. What stage of change do we think that Juan is in here? So, and sometimes they overlap a little bit too. They can overlap, and sometimes it's not always super clear and easy to see, by the way, right? We see this in the clients that we serve. I work for a behavioral health organization. We serve people with pretty serious mental illness. It's a community mental health here in Muskegon, Michigan. And those stages of change, sometimes they overlap a little bit. But, I would say that Juan is making significant changes to his lifestyle. So he started that process. He's incorporating regular exercise. So he's probably planned and he's active. He's doing it. At this point, Juan is actually doing the work. So this last one. So Maria has not had a drink for 8 months after struggling with alcohol use for years and years, right? She's successfully gone through the action and maintenance stages of change. She was attending support groups. She was regularly going to those groups. She was developing very healthy coping mechanisms. And now Maria recently experienced a lot of stress in her life, including a demanding work project and conflict with a friend. And these stressors have triggered some old habits and thoughts, and she's gone back to drinking as a way to cope. What's happened here? Relapse has occurred. What stage is she in? Hard to say, right? Until we ask Maria more questions, we sit with her and say, okay, you've relapsed. Let's talk about that. What are your thoughts? Well, I know it's bad for me. I know she may not have relapsed all the way to pre-contemplation. She may be at that spot where she's like, okay, I had a rough go. I relapsed briefly last week. I got to get back on track. So we probably got to ask some more questions, right? And we've got to figure out where she fell back to, and then ask those same questions for that stage of change. If it's somebody says to you, I've relapsed, I don't really care about stopping drinking right now, I don't want to talk to you about it. Well, that's a pre-contemplative person. And then we've got to start all over again with them. But the whole point is you are walking this path with that person. And this means you're going to experience the same. It's not your life and it may not be your health impacted, but you're going to feel that frustration. And hopefully your frustration that you may feel, maybe not all of us, some of us are very good at this work, right? You may not feel frustration. But if you do feel frustration, you have to be aware of that bubbling up in yourself and not let that intrude on your conversation. This person probably feels dramatically worse than you do, right? When somebody relapses, it's really hard. There's shame, there's embarrassment, there's all kinds of things that we can experience. And we want to be aware of those things. So when somebody does relapse, let's be really, really cautious about how we approach that relapse. We have to work very hard to not be judgmental. That's the expectation many times when we're helping somebody, even with quitting smoking, and say we're walking that path with them, they're taking the steps, they relapse, they're smoking again. And a lot of times they're on guard for people who may want to shame them or be judgmental about them. And in the work that we do, being non-judgmental is just going to make for a much better relationship with that individual so that they know, hey, we're here. As soon as you're back on that path, I'm here. If it takes you a while to get on the path, I'm here with you. I'm not going to judge you. I'm not going to humiliate you. I know it's not easy, and I'm here for you. This is the conversation. And I want to also believe that, I've seen the pendulum swing in social work circles over the years where we couldn't even really talk about compassion and empathy at points in my career, right? Oh, there's boundaries and you don't cross those boundaries and you don't say certain things to people. And occasionally, we do have to have boundaries, but we need to always be thinking about it from the perspective of, I'm walking the path of change with this individual at this point in time. I'm going to meet them where they are on that path. I'm not going to drag them to where I am on the path. I'm not going to say, well, I'm the worker and I'm here to do this with you. Therefore, you must do this, because there is no doubt many of you listening to this right now, and your doctor has said to you, you should do X, Y, and Z, and you've not done it, right? We can all think of those times in our lives when we have not done what we probably should be doing for our health. When we are judgmental, that does a lot of, or if we're even perceived to be being judgmental, that does a lot of damage to that therapeutic relationship, or that relationship that we have with that individual. Now, some of you, look, we're all human beings and we have our families, and we know that in our families, we have somebody who may have a drug or alcohol problem, or more than one person, and that frustration is big and it's real and it's challenging and it's difficult. So when we talk about helping somebody on that path where they're at with that stage of change, we also have to be aware of what we have in ourselves from our own family members that we wish would change. Why are you eating all the cake and cookies at the family reunion? You've got diabetes. They're threatening to amputate your feet. Why? Stop doing it. Right. With family, it's often more personal, and therefore it's harder to not be as distant from it. And we can drag that into our work. This reminds me of my family member, and they won't quit this bad habit. We have to be aware of what's in us too. Our work is to learn the motivational interviewing model and the questions we would ask for the various stages of change, and stick to those. Stick to those. And hopefully they'll be very helpful for you as you move forward. So the stages of change model, it gives us that framework for understanding that process. What do we do when we're trying to attempt change? And it's a valuable tool when it comes to motivational interviewing. So recognizing the stages helps you to tailor those interventions you are going to use to support that person on their path towards recovery, towards quitting and their recovery. Do it for the individuals you're serving. Do it for yourself, right? We've already talked about burnout and compassion fatigue, and that this is a tool to help you suffer less potentially with compassion fatigue and with burnout. So it's going to make it better for you. It's going to make you a healthier care provider. And it's also going to help the individual you serve. With that, I am going to stop sharing at this point, and I'm going to ask, I know that time is short, but I'm wondering if you have any question. And I'm not the be-all expert on motivational interviewing here, by the way. There are lots of people way smarter than me. And many of us do this instinctually. We already do this with people, right? We're good at it naturally. And then there are others of us who struggle and we get frustrated with the people we work with. And we have to be honest with ourselves about that, right? So we got to gravitate towards the people who are good at it naturally. And nothing is new under the sun. Motivational interviewing came around, over the past 25, 30 years, but it was based on a book from another therapist, psychiatrist from the 50s. He based that on something from the 1920s. None of this is rocket science. It's how we should treat each other as we're working towards change. Questions?
Thank you so much, Michael. That was a great presentation. I think that with that, we're just gonna share at NCFH. We're working on the new resources coming along with everything that Michael just described. It's gonna go over the stages of change as a health intervention for health center intervention for tobacco cessation. So be on the lookout for that. Everyone who registered or attended today will get that follow-up email when that's ready as well. So we look forward to you having it and being able to utilize it. And we are also having a companion to it, which is a patient resource that's Path to Quitting Tobacco. What does yours look like, and it's putting it in the patient's perspective as well. So be in the lookout for that. And with that, we want to thank Michael for today's presentation and everyone who's attending today. We're going to say goodbye to those listening in, and we're going to stick for a little bit afterwards, just for any questions and answers that those attending lives and the live session may have. So thank you for attending, and thank you, Michael.